going to be the operator? Who's going to be the patient?
I'll be patient.
I was group designated.
My feet were hot.
So she's going to be your patient?
Super bad
Yeah.
bot.
Okay. Who's going to be the reader?
I guess I'm.
You're doing it wrong.
They don't care. They leave you alone. You go, whatever. We don't know you anymore.
Here's the deadbeats.
We're the deadbeats.
What's your scenario?
Okay.
Tell us what's going on.
Okay. She's a a chronic stroke patient, right-sided stroke. She's got a frozen shoulder on her left side. Because of her stroke, she's got diminished gait. Treatment, we're supposed to treat her left shoulder using a different body part. With
I
that.
like that.
I don't like that. With that, we are supposed to show 2 ways to relax and 2 functional diagrams.
Slow.
Okay.
That's good.
Okay.
I'm going to have you lay down for me.
I had a stroke.
I had a stroke.
You should already be laying down there.
So which arm is the one that is stroke? Which arm is the one that is the frozen?
Right arm, and then is the stroke. The left arm is the frozen shoulder.
Okay.
The left shoulder, rather.
Okay. So
So, for the frozen shoulder, 2 ways to relax. You can use,
the thing is that you cannot touch the shoulder. That's right.
right.
Okay.
Look at me.
It's okay.
Yeah. I know. I don't know.
Happy New Year.
We were thinking about, it's really hard to think about, how do you do that? But we were thinking about the scapulopelvic pattern and doing that, but that's touching the shoulder.
Okay. Okay.
So demonstrating, so I guess I'll have to have you turn around to demonstrate to the class, or I can go right back to you. Stand me on the left side. No, you're gonna turn to your right. There you go. Scoot my way.
Do not get this on camera.
No.
Okay,
Of course
so
not.
The idea is somehow to create some motion in the shoulder, okay, without touching the shoulder, okay. So what we can use? Pelvic pattern. You go for a pelvic pattern. You need to touch the shoulder.
Okay.
Okay, so if he goes to anterior elevation, what is going to happen on the shoulder?
Posterior elevation.
Now, put here in supine. Okay. So if you do flexion, adduction, external rotation in lower extremity, what is going to happen with the scapula?
Flexion. What was it again you doing?
Flexion, adduction, okay?
Flex.
Lower extremity. Posterior elevation, same thing, because we're going to anterior elevation. So you can start doing, okay? If you want to do bilateral or bilateral, I don't care, but you can start this way. I will start working my lower extremity. I will try to hit the scapula from here so she can relax. Okay? Okay, got it?
No.
Okay.
Can
She
you
had it
demonstrate
from-
what you just said? I
Huh?
have no idea what you're talking about.
Flexion. Flexion.
Buddy, wake up, come on, it's Tuesday.
Flexion, adduction.
Flexion, adduction, she's going to anterior elevation, so the scapula should go to posterior depression. Okay, because we want anterior
Oh,
elevation the same as
okay.
always, so that's what
Just,
it is, okay?
you kind of roll it away from
Now,
it. By it not
Now.
moving, it goes into posterior depression.
you got it?
No.
Is that what you're
why
saying?
does that move the scapula? I don't understand.
It's
part of
pelvis
It's
on
part
has
of the
scapula.
UK pattern.
Are you having
You
her
just do-
resist your
Oh,
movement?
yes, of course, yeah.
So she,
Like
Can
when
you
you
do
walk.
sideline
It's just
now?
like when you walk, you're going to flexion AD here, this arm's.
Why couldn't you do it sideline?
So
Yeah,
you're
but-
doing the exact same thing,
Why can't you just do the sideline anterior elevation?
because I want to be complicated.
You said not.
But it would be right.
Well, because again, you can say, well, maybe she's in silent, she could be painful, because she has shoulder, painful shoulder. So I will start in supine, relax, you know what I mean, so I can take care of the pain, you know what I mean, and start with lower.
so she's trying to extend her leg?
No,
Or
flex,
as she's trying to flex, you're resisting the flexion?
flexion, she's going to
Okay.
go to posterior
Okay.
depression.
See, that makes the sense. I thought you were just throwing her leg up here and oh, the shoulder's doing all of this.
we ever done that?
I missed a day. I might have missed that. I don't know.
Yep, that's all right.
That was it.
You better buy the DVD or.
I got one.
Okay,
Okay, so what else?
That's okay. I didn't understand it
One
either.
way to try to relax the shoulder, another way we were gonna do, if she has pain, you can do hold relax
Okay,
and progress that into.
okay, I told you she has a chronic right shoulder.
Chronic right, yeah,
I didn't tell you how much is the motion.
right.
Well, that's why we're doing it on the left.
We're doing the frozen shoulder, right?
We're doing it
So
on the
like I
first.
said, well, let's see how is the right shoulder working.
Okay.
So you can, if you do rhythmic initiation on the right shoulder, what's going to come on the left? It's going to relax.
Sure.
Right.
So you kind of kill two birds with one stone on that one.
Okay, so you do rhythmic initiation slowly, you do the dynamic, okay, slowly, whatever rate you have on your right one, you see that could affect, okay, your left shoulder, okay?
Can you do any pattern?
Sure.
But if she's,
And actually, I had a coworker. She was my student, and she was a coworker. So she took a job with us. And I had a frozen shoulder, long guy, big dude. She goes, well, he has a frozen shoulder. I mean, can you help me out? And I started treating him with. I never touched the shoulder. And she goes, look at me. And okay, we got afterwards. Sure, well, no problem. Because you can somehow you can go and direct it. You know what I mean? Works all the time, sometimes works, sometimes not. You know, it depends how the patient, the position of the patient, and sometimes works very good. Okay, so you can start with a rhythmic initiation, okay?
on the right.
Okay, on the right side,
With
see how
any
that goes.
pattern? Any arm?
With any
Any
flexion?
Whatever pattern you can get,
Okay.
any pattern. Okay, they say that if you do a technique on the right side, you usually have the same effect on the left. There is a communication between the right and left. Our hemispheres are connected, okay, all the time. So whatever you do on the right, you have some point on the left, okay? So you can do that, okay? Pattern, whatever she can do. And again, as I told you, she has a frozen stroke, but you don't know how much restriction she has. So whatever you can do, okay? So that's an idea, okay? So what else you have?
And then just, besides the relaxing, just do functional diagonals.
Give it to functional on the left side.
Functional diagonals on the left side, well.
What should be the
On the
most?
left side?
On the left side. She's relaxed, she's wonderful already, she's doing well. Which should be the most functional diagonal in piano? Flexion and reduction rotation, that's the most functional.
Flexion
Flexion,
A.
DVD, that's the one. That's
A.
the most functional.
Okay, flexion 8B.
May I ask why?
Yeah.
That's the reaching process. Okay?
What about the gait process though?
Well, it's different, but when you're reaching, usually you don't reach that way, you reach that way.
Okay.
You
Yeah, I
can go
know.
that way
Okay.
too, But usually you reach that way. Is the way.
Okay.
That's the most functional. So go ahead, show me that. Okay, make sure, okay?
Yeah, I think my hand is.
Show me.
Yeah.
How is your range? Where are you going?
Going to where she can't go anymore. Is
Her
that
hand
okay?
on
You
the
having
back.
pain there?
Wonderful grip.
Whatever.
Okay. Where are you pain-free? Where does the pain start?
Right here.
Okay. Thank you.
Come on!
It should be relaxed.
Crunk it!
That would be my interim right there. Back it off a little bit from the pain.
So,
And then start there with hold relax.
and again, some people are going to respond going indirect and direct technique. So you can go to extension to relax flexion, you go to flexion to relax flexion. So whatever you feel that is basically going to respond. There is no magic or no recipe for that. Okay, you need to try. Okay? Got it? Questions, audience? You got it?
Yeah.
You wake up now? Okay.
That's why it's good for these cases to be given to us because we don't think like this when we're just doing the motion.
Yeah, that's
Who's
right.
next?